Hello, I'm Lisa Cheek and I'm Director of Nursing Midwifery here at the RUH. Personal protective equipment, PPE as we know it, has been in the news a lot over recent weeks, and even if you weren't in the healthcare setting, you would have heard a lot about the different sorts of PPE such as masks and gowns and visors and some of the other vital equipment that we need that's been essential during this pandemic. Keeping our patients and our staff safe is always our priority. We're following the guidance from Public Health England to make sure that we've got the right supplies of the right equipment at the right times so that we can continue to provide safe, high quality care to our patients in a safe environment for our staff. We're receiving PPE through our national NHS supply chain. However, here at Bath, we're also very lucky to have the fantastic support of our wider community, who's helping to supply and boost some of our key essential items. It's important that our PPE meets the right specification, and so in particular we've been working with our local universities, the University of Bath and Bath Spa University, who have been using their skills and expertise to produce disposable visors that we can use and fluid repellent gowns. Alongside this, they're also able to produce things that will actually help our staff to be able to wear the PPE more comfortably as well. We're very grateful for all of their expertise, for their innovation, but more importantly for all of their support.
My name is Professor Richie Gill from the Department of Mechanical Engineering at the University of Bath. When the COVID crisis started, we got in touch with the hospital and asked how we could help. And the hospital was quite keen to get some protective equipment made. So the main thing that we're making are these face shields, and it's made from an A3 piece of acetate, and we copied the design of the existing face shields that were used in the hospital. So the standards that you have to be able to meet is to make sure you've got adequate coverage. We've created a 3D print of a standardized head form that's used to check coverage, and we're also doing droplet testing. Of course, we want to make sure what we're supplying meets the standards. So one of the things that we were asked to do was to make the wearing of face masks more comfortable. And what this does, it offers a safe and infection control compliant way of safely and comfortably holding the face mask on, as opposed to using a fabric face mask. And we can make about 140 of these in an hour, so they are readily made and disposable. So the RUH also asked if we could help with disposable long sleeve gowns. The RUH provided us specific material which is fluid resistant. We're now set up to, together with Bath Spa University, to use their facilities, and we've got enough material delivered today for about 4,000 gowns.
Over the last month or so, Dr. Lunt from the Department of Mechanical Engineering at the University of Bath and I have been in touch. We've worked collaboratively in the production of face shields and other PPE, and I've been overwhelmed with the support, the time and the generosity of the university and their donors in supporting us in delivering this enormous challenge. So on behalf of intensive care, theatres, anaesthesia, surgery and the emergency department, thank you to you all for your time and generosity in protecting us from tens of thousands of high-risk patient contacts. Thank you all very much indeed.